Good, good morning, everyone. So pleased to have you with us for this, our final pre-summit webinar for the Global Health Catalyst. My name is Dr. Lydia Asana. I have the absolute pleasure of leading our Young Catalyst program. And so today we will be focused on opportunities for young people. That doesn't mean that if you have more wisdom under your belt, you shouldn't join, because we are hoping that our seasoned researchers and faculty and organizational leaders who are on will also get information that will be helpful in giving opportunities to the young people involved in your organizations, in your labs, and on your campuses. So the idea for today, we want to share examples of how young people are intricately involved in all that we do with the Global Health Catalyst. And we will have some young people share for themselves what the experience has been for them, what they've learned along the way, ways that they've already contributed, and things that they've gained. All the things that we talk about with respect to the work that we do at the GHC, the collaboration, the leadership, the service, the cultural humility, all those things our young catalysts are already experiencing. They are being mentored, they are getting trained, but they are also doing the work. So when you see our beautiful flyers and you see the videos that are made, we have young people running webinars each week, supporting publication efforts. They are intricately involved in research, and the educational courses that we have. We really have a lot of young people who are full-time in. I mean, we're all part-time volunteers, but we're all in. And so at the GHC, we don't look at young catalysts as those who are coming to take over from us in years to come. We actually acknowledge that they are making meaningful contributions right here, right now. And so today we hope that by the end of this webinar, everyone who is on will see how they as young people, or they as those who have opportunities to support, engage, mentor young people, can get other young people involved. Now, the key words that we always talk about in terms of our Young Catalyst program, we always talk about engaging. That's the first step. We would like to have young people engaged, to be aware of what's happening, to see the flyers, to attend the webinars, to come to the summits, because it's hard to explain what global health entails. It's hard to explain what a GHC summit really is until you get there. But there's so many opportunities, and we do have more and more courses and programs and certificates related to global health. But we believe that when young people get their feet wet by participating, by getting engaged, it's the first step to exploring opportunities that they have. The second word we often talk about is equipping. And so we are all about helping our young people develop skills that will help them be successful and impactful in global health work. For those of us who've been doing this work for some years, we know that it's not just the academic training, it's not just the international travel, but even little things like being aware of working across time zones, across cultures, and maybe the meanings that one color has in one culture is completely different from another. And so we want them to start building that awareness, that cultural humility, that ability to speak with confidence, the ability to coordinate and collaborate and work with others. And you'll see for yourself today some ways in which our young people are already doing that, taking the initiative to start programs and call in collaborators. I'm super proud of the work they've done. I can't wait for you to hear. And then finally, we entrust our young people. We believe that they are capable to get things done. And so once they're engaged, once they've developed some skills and been equipped, we entrust them with supporting programs and even heading programs. They come up with ideas, we provide them with some feedback and mentorship and support, and they start things on their own. And so I'm really excited for you to hear how that happens. So to begin the day, we will start, we engage young people as young as high schoolers and from different parts of the world. We do a lot of work virtually. We meet virtually a few times a year. And then we also invite meetings at our summits, of course. So for today, we want to give you the opportunity to hear from young catalysts who are at the undergraduate level, who have started their own club on their campus, and to give an idea what that looks like and what they've been able to accomplish and learn along the way. And so we will have Vrishni, who is the president of the Global Health Catalyst Club at the University of South Florida's Judy Genschaft Honors College, one of my favorite places because I teach there as well. But Vrishni will be sharing that undergraduate perspective, how she's been engaged and what her club has been able to do. And then we'll move on to a non-institution affiliated club, because we do want to emphasize that you don't have to be part of an institution to be part of a GHC club or to be a young person engaged. And so Labenimo and Susan will share how they, as young catalysts, have a club that is global and engages young people in multiple locations. And after that, we will have Dolgun and Saif. They are further along in their academic journey in medical school at Virginia Tech. And so they will be sharing as postgraduate, graduate level, med school level, the ways in which they are involved, not necessarily through an institutional affiliation, but working with some of our GHC faculty, researchers, staff, getting mentored and taking responsibility for some of the work that we do. We would encourage all who are on the call to use the Q&A to ask questions. We actually will also ask you to give us some input for a project that we are about to launch. So we look forward to your ideas for us to consider. And then, of course, to have some questions for our young people that may help you as you consider ways that you or the young people in your life can be involved. So without further ado, I'd like to ask Vrishni to share with us how she got involved with the GHC as an undergraduate student, what her club is about, and give us just some examples. They've worked hard, they've done a lot, but just a few examples of what the Global Health Catalyst Club at the University of South Florida has been able to do. Vrishni?
Hi, good morning, everyone. Can you hear me? Wonderful. It is truly a great honor to be here and to share with all of you, firstly, some of my personal perspectives on global health very briefly, and then to talk a little bit about what our club, the Global Health Catalyst at USF, has been engaged in so far. And I speak not just as the president of this very eminent student chapter, but as someone deeply committed to a shared vision of equality, equity, access, and human dignity in health. When I co-founded the Global Health Catalyst at USF together with my dear friend Julia, who I think is on right now, I remember feeling two things quite vividly. Firstly, a deep excitement at the possibility of building something so meaningful. And then somewhere in the background, a quiet apprehension about the scale of the goals that we were setting. Global health for me and for all of the members of USF GHC isn't just a buzzword or a distant idea. It is a space of urgent and complex and often disappointing realities, but also one of immense possibility, as I will share with you soon. And I knew that to truly serve this space would mean facing big questions, many of which I asked Dr. Asana of all hours of the day. And these questions, concern things such as systems, justice, collaboration, and very importantly, responsibility. And I knew that we could plant something, even small, a conversation, a partnership, an initiative, but with lasting and real impact. And we can help grow it into something meaningful, just as the International GHC continues to do so well. And global health to me is something personal, and I'll just share a minute of why this is so. I grew up in Trinidad, as did Julia, where rural healthcare inequality wasn't something that you studied in a textbook or you watch videos on. It was something that you lived. I personally saw family members navigate long distances just to access basic care, or sometimes dreams of basic care yet to be realized. And I saw how structures meant to heal often failed to reach those who needed them most. That early exposure shaped how I and how many members of the USF chapter of GHC see global health and see the importance of the work that we are doing, not just as science, but as a tool of advocacy, not just about curing illness or things tangential to that, but restoring fairness. And so the Global Health Catalyst at USF has become for me both a mission and a mirror, a place to work towards better systems while staying grounded in the lived realities that first brought me into a love for global health. It's a space where, for me, and a member actually shared this sentiment with me recently, and I thought it's such wonderful phrasing. It's a space where passion meets pragmatism, where big dreams take root in the soil of real action. And this past year, I've had the privilege of watching our club grow, both in reach and depth. And I'll share just really briefly what some of that looked like. So we were founded just last year, around mid last year. And one of the first things that we had done before we even were able to register as an official club is we were given the very esteemed opportunity of presenting in June 2024 three student-led research projects at the GHC Summit in Johns Hopkins, where most of you would have been. And I was telling Dr. Asana that this is one of the most eye-opening and enriching experiences that I've experienced in my life, and many members shared similarly with me. So standing alongside global health leaders, researchers, policymakers was incredibly rewarding. And what was important is that we were not just onlookers. We weren't just participants for the sake of being participants. We were real contributors. And I applaud the International Global Health Catalyst for creating such a space for youth because it is significantly lacking in the current global health landscape. The USF chapter brought our voice, our questions, and our commitment. And to be named Club of the Year in that space, surrounded by so many brilliant and driven minds, was both humbling and affirming. It reminded us that student voices matter, which is something that is not often reassured to us, and that grassroots ideas can shape global conversations. Another key initiative that we launched this year was our non-communicable diseases awareness and advocacy series. That was my brainchild, and I have long been wanting to do a project like this, and GHC afforded me the space for this. We began with a focus on diabetes, a condition that silently shapes millions of lives around the world, often in underserved communities. We hosted both a workshop and a seminar facilitated by members of both USF Health and Tampa General Hospital. And this brought together students and clinicians and public health leaders in a way that I thought was beautiful and greatly enriching to students. And some things that were discussed, just general themes were things like early screening, diabetes technology, lifestyle interventions, nutrition considerations, cultural contexts, globally and on micro scales as well, community contexts. And these were not just academic exercises, which is what I thought was most beautiful about it. They were moments of community learning, and they reflected our belief that health education should begin where people are, using language and tools that they understand. But none of this work happens in isolation. And I remember since spring 2023, taking Dr. Asana's class till now, one key word that she always shares is collaboration. And that's something that I and the rest of the club always try to prioritize in our initiatives. So one of the most meaningful developments this year had been our deepening collaborations with like-minded organizations on campus. And these included organizations such as the Undergraduate Research Society, the Capsule Health Humanities Journal, and even USF organizations such as the USF Wellness and Counseling Center. In fact, we were able to get two of our members of the Peer Mental Health Project qualified with Together All through the counseling program at USF as part of a deepening collaboration between us. So that was quite positive to notice. And these partnerships remind us that global health doesn't just happen in textbooks or in faraway places that we read about on the internet or in articles. It begins in classrooms. It begins in webinars like these, in conversations, in the ways we choose to align our values with our actions. Together, we at USF, GHC, and macrocosmically in the entire GHC, we're building something broader than just an organization. We're building a community of future physicians, researchers, advocates, volunteers who understand that to serve the world, we must first understand it in all of its complexity, beauty, obscurity at times. If there's one message that I'd like to end with from the members of the USF Club, it's this. Global health is not a field reserved for the experienced or the elite. It is for the committed, for those willing to ask difficult questions, sit in uncomfortable truths, and work steadily towards better answers. It's for those who believe that no life, regardless of geography, income, circumstance, is less worthy of care, less deserving of hope. So yes, when we began, there was apprehension, there were many questions and texts to Dr. Asana and to Julia from me. But today there is momentum, there is movement, and more importantly, I would say most importantly, there is community within USF and with you all. Thank you to all of you. I'd like to end by saying, for supporting our journey so far, especially Dr. Asana and the other members of the International GHC. You are all mentors to us, and by empowering us, you make us feel like our voices have merit and that our actions are rewarded. And we are just at the beginning. We carry with us the stories, the faces, and the futures that remind us why all of this is important. Thank you very much.
Thank you so much, Vrishni. I feel like I can retire now if you speak on behalf of my former students or my current students. That was so well put. And I hope that those on the call are beginning to see just what opportunities our GHC young catalysts have. And I can't say I can claim all the credit for how well spoken Vrishni is, but I will say one of the things we emphasize is the ability to speak in public, the ability to take leadership even while they serve. And so she has exhibited that just through her presentation. Thank you, Vrishni. We'll go ahead and move on to our next group. We'll do all three groups and then have an opportunity for questions to these incredible young people. So I'd like to invite Labenyumo, and I'm hoping that Susan has also joined to share with us. Labenyumo, you can go ahead and see if you're able to share screen. To share with us what it's like to start a club that is not affiliated with an institution, but that has been able to already have global impact. So welcome with me, Labenyumo Patrick.
Hi, Dr. Lydia. Thank you very much for that introduction. I actually requested to be able to share my screen. It said I had to request, and I think Susan is also here with us.
Okay, if Susan is on, we'll get her spotlighted and for you to be able to share if we're having any issues. I've got the power to make it. Oh, there you go. Is this your screen, Patrick?
Yes.
Okay, super.
Yes. Can you see my screen?
Yes.
Yeah, so good morning, good afternoon, good evening, depending on what your location is. I am Labenyumo Patrick, and I am a grad student. I'm actually graduating this May, probably in like a week from Rutgers. I study computational biology. I also have a Master of Divinity, and I will be talking about STEM Guardians, which is one of the clubs that I and a group of friends of mine founded under the Young Catalyst. And my presentation is going to be with Susan. So I just want to give more of my presentation. It's going to be pictures, so I hope you can follow more of it. But the idea really started in 2023. And the pictures I'm showing you is a picture of me and a group of people. And if you notice very well, I don't have a pointer here, but this picture to the middle where you see me standing next to flags. This was after I'd made a presentation at the Global Head Catalyst happened at the University of Pennsylvania. And back then I was a student at Drew University. I was in seminary getting my MDiv. And I thought about this really interesting idea of, how you could think about the ideas of the STEM Avengers coming together to fight big real world problems. And this idea, I communicated with Dr. Will and we talked about it. And in some of the pictures to the bottom of the pictures you see, top bottom, you see Dr. Will making a presentation there. Basically, he was just trying to help me pitch this idea to students at Rutgers. This was at an event where Dr. Will was talking about the work he does, and this idea that we could actually collaborate and do collaborative work to solve some of the world leading problems similar to what the Avengers did in the movie, some of us might know it. So these are just pictures showing how we started from the Global Health Catalyst at UPenn in 2023 to me being at Rutgers with Dr. Will while he was teaching there as a presidential professor there. And then this is another slide just to show you how it's going. This is the Global Health Catalyst at Johns Hopkins School of Medicine, the most recent one. And some of the pictures here, again, just showing me presenting some of the things we did. And you could see students over there on all of this. And just to tell you who we are just a youth-led organization. We have different individuals from different parts of the country, have people from Cameroon, Gambia, Nigeria, Kenya. And really the idea is we are committed to discovery, innovation, equity, and we have our focus really on health. So what we've really done is we have a lot of people who wanted to be part of what we are doing. So instead of having them have separate, having them let go of their own clubs or the organizations, we just suck them in, basically take them in. And so we have 3As, which we've joined collaborations with. We have Elevate initiatives where we have somebody from Nigeria who has this amazing work that she's doing with young girls, where she gives pads and stuff like that. And so we meet every now and then we talk about ways in which we can be innovative in the way we collaborate. So this is really who we are, just a young group of individuals who have a big dream of trying to make a difference with focus on health, science, technology, engineering, and math. And we also done a couple of events. One of our events that we've done is the STEM chess for STEM minds. So the idea really is you think about a place like Nigeria, in northern part of Nigeria, there's a lot of displaced individuals. So the idea for us for this event was really to get kids to do chess, to get them busy. Because I remember growing up in Nigeria, because I'm from Nigeria, and we played soccer. And for some people, maybe it might not be the case. So we got them chess, and the idea is you want to improve their mental health. But not only that, you want to give them something to do. And with chess, it's known that it improves cognitive abilities as well. So we got them chess, and we distributed this chess, and we had volunteers on ground who led the events, and you can see the pictures here. And to the left, you see a picture of me standing right there while I was doing this event. I also had the opportunity through the Young Catalyst and the Global Health Catalyst to be selected for an NIH career program at Johns Hopkins School of Medicine, where I was working on flash radiotherapy. And so I was simultaneously doing these events in Nigeria with my collaborators and friends, but also doing some amazing work there at Johns Hopkins, where I did some work on flash radiotherapy. We also went on to do some work around book clubs with our collaborators. This is also in Nigeria, where we thought perhaps we could distribute books to individuals, young kids who might need them, who might be interested in learning to read. So we had our collaborator Albert there. We got some books through fundraising with the help of Dr. Lydia. We talked about the plan of this events and what we needed to do and what we needed to achieve, raise some money, and we got some books, and our collaborators actually got on to do this event. And we thought this event was really interesting because not only was the excitement from the people we're working with, but also our volunteers are really excited to do this kinds of work. So that was our next event. And then we thought, okay, what else can we do? Next event again, we decided to do something around cancer awareness. And we went to a high school and had our collaborators and volunteers. And we did around about 60 students at a high school somewhere in northeastern Nigeria, where we spoke to students about why it's important for them to have some basic knowledge about cancer, essentially. And we believe that the youth are the future. So in some of these remote areas, if you have someone someone in high school who has basic information about cancer, that might make a difference in the life of their grandparents or the older people around them. So this was a one-day event. It was very simple, very basic, but again, it just goes to show how much difference we wanted to make. And so planned the event. It was a very successful event, and we had speakers all over from the US. I was actually joining here from Philadelphia. I'm right now in Philadelphia, so I was joining on Zoom. We had speakers on ground, and we had some people in certain part of the states, like Florida. We had Ishan, who was also helping us coordinate. So it was very, very good event that we were able to do. And so we wanted to do something big. And we decided to do something at the University of Buea. And this was really, really a big event for us. So for this event, one of our collaborators on ground was Susan. So I would let her say more about this particular event that we had.
Hello, everyone. Good morning, good afternoon, good evening. Okay, so I am Tajucha Suzanne. I'm a public health professional. I'm a public health professional, and I've been working tirelessly in the field of public health, aiming to improve health outcomes of vulnerable populations using community-centered approaches and health system strengthening. I remember in 2023, my friend lost his grandmother to cancer, and it was a very devastating time for the family. And forwarding to December 2024, when Dr. Flore reached out to me, presenting an opportunity to organize the Oncology and Precision Medicine Conference in Cameroon, I was very happy because I saw this as an opportunity to advocate for an improvement in cancer care, in Cameroon, because the challenges are enormous, and over 70% of cancer patients pay for care out of pocket. And it's really challenging because 43% of the population live in poverty, and government funds and subsidies are able to cover for just less than 10% of care. And we equally have poor infrastructure. We have just about 6 adult cancer treatment centers in Cameroon with 6 oncologists, 3 radiologists, and we have 14 healthcare professionals, meaning nurses who are trained in cancer care. And this greatly reduces the quality of care that patients get to receive here in Cameroon. So I was really drawn to this. And the goal of the conference was to bring together, students in STEM, as well as young professionals, to be able to present to them the existing disparities in cancer care and equally show them opportunities in personalized medicine, which they could get engaged in and help to eliminate some of these disparities that exist between the low and middle income countries compared to the high income countries. So our conference had in total over 300 participants, and we were able to share with them from a vast range of knowledge that our presenters came on board with. We shared on the general objectives of the Global Health Catalyst, as well as leveraging opportunities in personalized medicine using our local resources in Cameroon. So I believe that from the conference, we're able to encourage, the young students and equally the young professionals in Cameroon by showing them the roadmap through which they could follow to, help in improving cancer care and equally improving global health as a whole. So these are some pictorial excerpts from the conference. Thank you very much.
Thank you,
Thank you.
Susan. So that is basically a summary of one of the events we did in Cameroon. And so this is not only the things we've done, we're actually looking to further continue the work, this amazing work that we do with a lot of groups. So right now we are planning on doing another bigger event with a collaboration with a university in Kenya. And we already have a very wide range of speakers from all over the world. So we're excited about the possibility of this event, and we are very excited because we see the momentum. A lot of young people, a lot of people who are medical students as well, excited about the possibility of some of the work that we do. And so this is two of the next few events that we'll be doing. There's going to also be a menstrual hygiene day event that we'll be doing in Nigeria through the collaboration of one of our collaborators, who is the Elevate Her initiative. And so we have amazing work that is going on, and I think that it's a wonderful opportunity for us to continue to collaborate, and we're very grateful for the GHC and the Young Catalyst for giving us the opportunity, but also not only giving us opportunity, but letting us know that it's possible for these ideas to come to fruition. And we are very, very grateful to continue to do this work, and we encourage people who want to be part of this wonderful work that we're doing to join us. You don't have to let go of your own club or ideas. You join us. We bring you in and we collaborate, and you can always hold on to your idea, but we have a big umbrella, which is equity, access, and health. So with that, I would say thank you, and we're happy to take any comments or any questions.
Thank you, thank you, thank you. Thank you very much, Labinyimo and Susan. For those who are on, I am just so proud. I mean, I come alongside these groups and teams and individuals as they work on their projects, but to sit here and have them present and see it in third person, so to speak, just really emphasizes what we preach. It helps me appreciate that we are walking the talk in saying our young people are not just supporting and preparing for the future. You can see for yourselves, I hope, that they are already having lasting impact. I think we have successfully drilled into them the idea that collaboration is the best way to successfully carry out global health practice around the world. And they're already initiating those collaborations. Before we go on to our next group and kind of switch gears to a project we're about to launch with Dolgun and Saif playing a key role in those, just wanted to ask Vrishni, we have a question on there that I'll combine if you're still on, Vrishni. I know you had another commitment. So there's a question I'll combine in that, what do you think is the greatest impact that Young Catalyst can have, and how do you go about making such impact sustainable, like with the non-communicable project? So how can Young Catalyst have the greatest impact, and what's the plan for sustainability?
First, thank you for that question. It's something I ask myself every day. So thank you for giving me a chance to mention very briefly about that. With regard to greatest impact, I'll first preface it by saying I don't believe that any impact is too small. To me, any action, any attempt has merits, but the end goal, so to speak, or one of the main outcomes that the GHC at USF intends to achieve is advocacy and upliftment. And in that is kind of a two-pronged approach. Advocacy in terms of longitudinally, we'd like to hopefully see policy changes at USF coinciding with global health amelioration and the landscape here. And then upliftment in terms of community upliftment, both of the members and of the communities that we're trying to serve. To answer the second question, which was, I think, how we would have sustainability after succession planning, as with any organization that's robust, we need to have members engaged and we need to incentivize personal interest in them, which I think we do have here at USF, where members are aligned with the mission and vision. So succession planning, impact-driven programs, flexibility and communication, and importantly, adaptability. That's where our focus is at.
Thank you. Thank you for addressing that. So I do want to move on to Dolgun and Saif to give us a perspective for those who are in medical school, graduate school, and beyond. Again, our Young Catalyst program ranges from high schoolers all the way to early stage professionals. And so Dolgun has been, and Saif are very much engaged in putting together what will be our next groundbreaking course focused on AI. But I'll give them the opportunity to introduce their work, how they've been involved. And for those who are on the call, as soon as you've heard that word AI, there's so much going on about it. But at GHC, we believe that there's opportunity. There's opportunity to facilitate access to care, access to education, access to research by using AI responsibly. And so we want our young people to already have that in mind. There's opportunity. Their jobs are not going to run out. They just need to be prepared for how the field is changing. So go ahead, Dolgun. Thank you for joining us.
Thank you so much for having us. Just going to introduce myself really quickly. My name is Dolgun Megmorsuddin. And this is my friend and classmate, Saif Pasha. We are third-year medical students at Virginia Tech Carilion School of Medicine in Roanoke, Virginia. And we are working with Dr. Ingwa and many more people on creating this AI Catalyst for Global Health online course. So let me share my screen really quickly. Can everybody see the PowerPoint?
Yes.
Okay, perfect.
All right. Hi, everyone. As Duncan mentioned, my name is Saif. I'm also a med student here at VTC and excited for this opportunity to present to you all today. So I'll just start off with some background. So the global health landscape is undergoing a rapid transformation with the integration of artificial intelligence into various aspects of healthcare, as Dr. Asana mentioned. From imaging diagnostics and drug discovery to supply chain optimization and epidemic forecasting, AI is already making an impact on health systems in high-income countries. However, adoption in low to middle income countries is lagging behind due to challenges like limited data infrastructure, digital divides, regulatory gaps, and workforce capacity. Yet these same regions often stand to benefit the most from AI, whether it's scaling scarce medical expertise, improving early diagnosis, or making public health systems more agile. AI presents a unique opportunity to leapfrog traditional barriers. And despite its promise, critical issues remain, especially around ethics, fairness, explainability, and just local context adaptation. So that's why courses are essential to build knowledge, capacity, and leadership that ensure AI in health is not just innovative, but also accessible and impactful. And then, sorry, Dolgan, can you go back one slide? Thank you. Thank you. So globally, AI is already being used to enhance clinical care, especially in fields like radiology, pathology, and triage, where large data sets are available and pattern recognition is critical. So in public health, AI-powered tools have already been used to track the COVID-19 outbreaks, predict the spread of malaria, and assist with vaccine logistics, especially in those more data-rich and technologically advanced settings. So we're also seeing rapid growth in personalized health tools, including mobile health apps, wearable sensors, and remote monitoring platforms. So these innovations offer exciting potential for patient engagement and chronic disease management, though they're still largely developed and deployed in high income, high resource areas. Globally, in low and middle income countries, several promising pilot programs are underway demonstrating AI's potential to support diagnosis, supply chains, and community health. However, these efforts often remain limited in scope due to infrastructure gaps, lack of AI-trained health professionals, and insufficient local health data. So these systemic challenges make it difficult to transition from pilots to wide-scale implementation. Another persistent issue, as mentioned before, is that most AI tools are developed in these high-income countries and are often based on these clinical workflows, data environments, and patient profiles that may differ significantly from low to middle income country contexts. And this raises concerns about their relevance, usability, and even safety when these tools are applied globally. And so together, these dynamic points basically to a critical gap between AI and a potential reality, setting the stage for why a strategic, inclusive, and locally grounded AI agenda is urgently needed, which we'll explore next. And then starting off just with the COVID-19 pandemic, it didn't just disrupt healthcare, it also accelerated digital transformation, forcing systems to adopt remote care, data-driven decision-making, and new technologies faster than ever before. In many LMICs, this is happening while non-communicable diseases are rising, adding to the ongoing challenges of infectious diseases like HIV, TB, and malaria. Health systems are expected to deliver more with fewer resources. At the same time, health data is growing rapidly thanks to mobile devices, EHRs, and public health reporting systems. And this data obviously holds enormous potential for AI-driven insight if it's harnessed effectively. Funders, multilaterals, and governments are now increasing their focus on AI innovation in healthcare. But if AI tools continue to be developed for high resource settings only, these can lead to inequities. And so that's why there's this urgent need for context-aware AI approaches and why this course is timely. We're here to explore how AI can become a true catalyst for accessible global health and not just a high-tech solution for few. So as we look ahead, one of the most pressing issues or questions is who is AI being built for and by whom? So if AI tools continue to be designed without local voices from around the world, especially again from those low to middle income countries, they risk being inappropriate, ineffective, or even harmful in the very settings that they are needed most. So the digital divide, as mentioned before, if left unaddressed, could also deepen these health disparities, widening the gap between the high and low resource settings rather than closing it. And there's also a moral and strategic cost to exclusion. So some of these countries hold immense knowledge, innovation, and need. So if they're not at the table, AI will fail to deliver its full global health potential. And so that's why locally informed AI is not just ethical, it's essential to meaningful and sustainable innovation. So now let's look at some practical applications of AI across global health domains. In diagnosis and treatment, AI technologies are helping identify infectious diseases, again, like TB and malaria. And risk assessment and surveillance, AI can be used to predict patient deterioration, helping clinicians intervene earlier. On the policy and planning side, AI is emerging as a decision support tool, especially with the strategic use of limited resources, guiding where to allocate staff, deploy vaccines, or roll out public health campaigns, again, based on these data-driven models. And so these examples show that AI is not just a future possibility, it's already reshaping critical elements of global health practice from bedside care to national level strategies. And so before applying, we must address critical ethical and regulatory concerns, including data privacy, algorithmic bias, and ensuring systems are built and deployed equitably. So without these accessible designs and governance, AI could worsen the disparities it aims to solve. So from a practical standpoint, again, as mentioned before, some of these low to middle income communities can face infrastructure and workforce limitations, which can hinder AI integration. We'll obviously also need rigorous local validation of these AI tools before deploying them. So what works in one country or health system may not translate everywhere else. At the same time, these challenges also present opportunities. So with proper investment in governance, AI can significantly expand access to care and support universal health coverage and public health surveillance globally. And so overall, the key is to just ensure that AI is sustainable, scalable, and sensitive to local realities. So not just technically effective, but socially and ethically grounded. So what's missing currently, despite the progress we've seen, there's still a clear disconnect between the promise of AI and its practical use in global health. So firstly, there's a lack of accessible context-specific education that prepares healthcare professionals, policy leaders, and innovators to engage meaningfully with the rapidly expanding field of AI. Secondly, many AI tools are built in technical silos with minimal involvement from clinicians, public health experts, or local governments, which ultimately weakens their usability and relevance. There's also a critical need for ethical leadership and policy development to guide responsible AI integration. And this is something that can't just be outsourced or imported. And so that's where this course comes in. It's designed to basically close these gaps by offering foundational knowledge, practical use case studies, and a global platform for dialogue, discussion, and innovation. And with that, I'll hand it off to Dolgan.
Thank you, Saif. So that was a pretty in-depth background to kind of introduce us to our course, but we thought it was important to kind of get more up-to-date knowledge on the landscape of AI right now and how it can be and it is already being used in the healthcare setting and how we can broaden that application globally. So specific to our course, a brief description, it's going to be an 8-week online webinar series focusing on the AI's role in transforming global health, special emphasis on low and middle income countries, addressing diagnostics, treatment, health systems and policy, as well as how AI can promote equitable, ethical, and sustainable use. So to go a little bit more in depth, we are thinking about making the course 8 weeks, so we will divide them week by week. So for the first week, the course is going to have about 2 lectures who really specialize in that field. So the first week is going to introduce the students to AI, the basic concepts, key terms, really understanding the field, similarly to how SAFE kind of set the background up so everyone is on the same page, as well as AI's historical development, application of AI in global health, and how it can help health access globally. Week 2 will focus on diagnostics and personalized medicine. So specifically AI in medical imaging and pathology, AI for early disease detection, AI that focuses on personalized treatment plans, wearable and remote monitoring technologies, and regulatory and safety concerns. Week 3 will focus on AI for health systems strengthening. So this is going to be more on applicable to the broader hospital-based or community tools, such as predictive analytics and decision support systems, AI for workforce augmentation, how AI can help in that's redundant, and AI in medical education and workforce training, and also ethical considerations of AI. Week 4 will focus on disease management and public health, so AI in epidemiology and surveillance, AI for infectious disease control, AI in chronic disease management, such as cancer, diabetes, hypertension, and mental health, and social determinants of health and AI, understanding how AI integrates socioeconomic factors into health strategies, and as well as looking at case studies. Week 5 will focus on health access and policy development. This includes bias and fairness in AI, global health policy, AI for increased access, so ensuring that the solutions serve larger populations, including rural and underserved communities globally, public and private partnerships, regulation and compliance, and how AI, understanding the data privacy laws such as HIPAA in the US, and where AI kind of comes into that, and cross-sector collaboration for AI. Week 6 will focus on human and AI interactions and the trust component, and especially how that can apply in global health. So user experience in health AI tools, different collaboration models, explainability and transparency of when physicians and scientists and educators use AI, the trustworthiness and adoption, and AI in clinical decision support, as well as looking for more real-life case studies. And week 7, we wanted to emphasize on AI in mental health and behavioral medicine, such as looking at AI's application in mental health screening, telepsychiatry, and digital therapeutics, as well as discussing, again, the ethical implications of these AI chatbots and virtual therapists in the healthcare settings if it were to be implemented globally. And lastly, week 8 will be where it's going. So future-oriented AI solutions for global health. challenges. So innovations, the different emerging technologies that are happening right now, scaling AI solutions, overcoming barriers to AI adoptions in low median income countries and in rural healthcare settings. Sustainable AI for global health, so addressing energy consumption, environmental impact, and the long-term AI viability. And again, looking at the future of AI and how we can be implemented in healthcare and global healthcare. So a little bit on the specifics. We were considering 6 weeks, but we changed it to 8 weeks. So it's going to be 8 weeks, one live lecture that's about 2 hours. So a total of 16 hours. It'll be on via Zoom, and the recordings will be available. And participants are able to get certifications if they attend 70% of the lectures, and they will submit a 2-page project proposal by the end, and they will have the certification of completion of this course. So our target audience are healthcare professionals, researchers and graduate students, healthcare policymakers and administrators, international public healthcare professionals, and AI and data science professionals, and anybody else who would like to attend. So our team, our course leaders are Dr. Ingwa and Dr. Stephen Avery, and we are working with Dr. Fleury, Jeremy, Saif, and I. And yeah, that's all. If you guys have any questions, comments, suggestions, we are very open to hearing it. And if you guys want to contact us, this is our email. Thank you.
Excellent, excellent. Thank you so much, Dogun and Saif. And, you know, taking the time to give us some context was really important. We understand that in all global health work, we first need to understand the context in which we work in order to propose interventions that are supportive of local needs. And so that context is always really important. And I think one of the things you already mentioned and addressed is the importance of incorporating AI, because our primary goals of increasing access remain the same. And so this is an opportunity for everyone who's on the call to please share with us things that might serve as a barrier for anyone to join the course from a different part of the world, so that the team can consider that. We believe that the more people who have access to such equipping opportunities, the more impact that will have in those communities around the world. So if you have ideas of perhaps who you would like to hear from as a guest speaker, topics that may not have been mentioned that could be incorporated, anything that would help increase access for those who are interested, we would love to hear that. I'll ask 2 more questions. And then we do want to share information about our upcoming Hope Summit before we end the day. So if Susan is still on, Susan and Labinyuma, but maybe Susan, the question of really related to this AI, you mentioned some of the challenges already, especially related to cancer treatments in Cameroon, which are reflective of other low and middle income countries. But what are potentially some challenges in maybe getting participation from young people in different parts of the world? And do you have any suggestions that could help bridge those gaps? I know Susan and Labinyumo, you're already working in several contexts, and we're hoping that you will share this opportunity with others. Do you see any challenges in their engagement, or have suggestions to increase access to their engagement?
Yeah, I think overall, to get young people to do stuff, you have to get them to get something exciting for them to be willing to do it, because generations change. Back in the day, people just went to stuff because there's not a lot going on. Right now, there's a lot of social media, so it has to be exciting. It has to be engaging. You don't just want to throw a lot of information at them. So I would say they have to be willing to do it, but also you want to make it as engaging as possible, because then if there's a trade-off, should I go to this event or I can just watch TikTok? Then obviously, if the event doesn't give the same feel as TikTok, they'll probably switch for TikTok instead of the event. So for our events, what we try to do is, while we want to have experts from different parts of the countries, different part of the world to give expert information, we also have a lot of students doing the work. So we have like people who have to give, people who have experiences with cancer in that setting, who are young, to talk about their own experiences and how they overcame those experiences. Or we have part of our panels, we have students who are part of the youth that we're working with being part of the panel. So I think having them getting them engaged and making them part of the event is a motivating factor. But overall, I think to the question of the challenges is like how we market those events, right? Like we're still trying to find the best possible way. Sometimes we do banners, we have all kinds of things, but we have to do multiple things on multiple platforms to get people to see where these events are. So that's something that we really want to figure out what's the best way, because social media, it's good, but we also want to make sure that those without social media, because we're in a very limited set. We do those things in limited settings, so not everybody might have the internet that we presume they have. So we also have to cover for that.
Consider that. Thank you so much. Good idea. So in marketing, Saif and Dilgun, maybe contact Labinyemo. But one thing I'm hearing is highlight the fact that young people are involved in putting this together, so they feel I have something to connect with, even from a planning standpoint. Thank you. A question for Dilgun and Saif. There's a question about the AI course. There was mention of a project, perhaps the 2-page project. Will there be any advising or support for those who participate in actually carrying out the project that they're expected to carry out to be able to complete this 2-page paper?
Yes, I was actually just answering that, but I'm glad you asked. So yes, there will be advising, especially like we mentioned, each week we're going to have about 2 lecturers who are experts in that field. So the participants will have the opportunity to engage with them, to get in contact with them and seek advice and support and have their questions answered from them. But we will also kind of brainstorm on if the participants would like a more hands-on advising and support. I think we'll also be able to find those people as well.
Thank you. So Julia, who asked that question, if you have ideas, if you think of something that you think would be beneficial to participants to help support them in investing in this project and delivering something that they will feel like they can continue with, then please do share those thoughts with the team as well. Thank you so very much to all of our amazing young people. I hope that for all of you who know me, when I start talking about young people, I can't help smiling, but you've seen for yourself why. It's really a joy to come alongside, to hear their ideas and to facilitate, to enable them to take ownership and get some of these things done. I know that we do have a few more questions, but as usual, we do want to also honor your time and model what we are teaching our students and our young people, that we want to be able to honor our time commitments. I will end by sharing, please do send those suggestions and thoughts still in the chat, because we'll have that transcript and be able to share with the team as well. But I didn't want us to end without highlighting the fact that we have so enjoyed bringing these bi-weekly webinars and preparing us towards our upcoming summits. Each of these webinars, each of the topics have really just been a taste of what is to come at our summits. All of the webinars have been recorded. We continue to get those questions. We have a GHC YouTube channel, and so that is where you can get recordings of all the webinars, as well as a plethora of resources that we have recorded and content that we have over the years. So our next key event, like this was our leading up to, but we have our Hope Summit coming up on June 7th in Boston. It will be hybrid. So those who are able to be there in person, we always enjoy the face-to-face interactions, but we will have members of our team dedicated to our online participants as well. So please register, whether you can come in person or virtually. We will have, as always, amazing speakers, but also this Hope Summit is an opportunity to look back at 10 years of impact The GHC Summit started in Boston in 2015. We were there starting out with big hopes and dreams, but I dare say all that we have together been able to accomplish is far beyond anything that we dreamt of in those early days. So we would love to have you join us as we look back at 10 years of impact, 10 years of collaboration, 10 years of overcoming challenges. 10 years, we want to celebrate some of our leaders along the way within our team and beyond our team who have had incredible impact in global health. And we want to look ahead with hope at the decade and beyond to come. We still have big dreams, even bigger dreams, knowing that collaborations really do allow us to accomplish much. So please go to the GHC website, register for our Hope Summit coming up on June 7th in Boston. And then our full summit will be in September 19th to 21 in Boston. All of those, I think we still have, you can still submit an abstract for the September full summit and make plans to join us for our typical 3 days of information, education, inspiration, partnerships. We want to initiate new collaborations and strengthen existing collaborations. So our website has been posted. We have our LinkedIn group where we can as well start communicating and sharing and planning, connecting with those you hope to meet at the summit. I think those are the key things. If I'm missing something, anyone from our team, please share. Again, the recordings will be on our YouTube channel. June 7th, we look forward to seeing you there. September 19th through 21, we look forward to our full-fledged summits. Thank you so much to our presenters today, to Vrishni from University of South Florida's Judy Genschaft Honors College, to Labinyimo, who is graduating. Congratulations, we celebrate you. And Susan joining us from Cameroon. Thank you so much, Dilgan and Saif from Virginia Tech. We look forward to this new AI course and encourage all those on the call to share the information, register for yourselves or share with others who may be interested. And we look forward to celebrating our 10 years of working together and impacting the world literally through our GHC collaboration. Thanks so much for joining us today. Have a wonderful weekend and see you at the summit in June.